Cameron, we're in the very middle part of the house, the inpatient unit, and it's a very unique design. Can you talk about the intent behind this design?
So we really designed this desk here to be more like a concierge desk at a hotel, rather than being that traditional kind of barrier type space that you would have with glazing going right to the ceiling that you often see in mental health facilities. So the idea is that the staff members can get out, can kind of relate in a better manner to the patients. But the idea behind this space was really to be kind of like the living room of the inpatient unit. So there are lots of chairs and different kind of spaces. And we're really anticipating the folks will come out here, sit down, maybe play cards, watch TV, and have kind of social interactions on a kind of a smaller scale than we were talking about in the downtown area of the building. So there are 6-bed cluster down here, a 6-bed cluster here, and another 6-bed cluster over here. And we've used different colors in each one of them, again, to act as a wayfinding ability so that people really know which unit they're in.
The other wonderful feature here is that each of the clusters has their own lounge and nutrition center. So again, the opportunity for small groups of patients to be together, and then again, as you say, opportunities to come out and be in a bigger group if they are so inclined.
So it's that whole idea of transition of, you know, having the very private spaces in the patient's bedrooms. They can move to one of the lounges that's within their cluster, or into this area, which is more kind of like a living room. And then gradually, as their transition progresses, they'll go to the neighborhoods or the downtown parts of the building.
The other feature on each of the inpatient units is a relaxation room. And this is a room that includes an anti-gravity chair, really comfortable surroundings, a water feature on the wall that creates a soothing, relaxing environment. And patients can access that room to self-calm, self-soothe, and relax.
So the single patient room is really a newer development in healthcare, and I think it's, you know, significantly different from where you have, you know, 4 or 6 patients in a single room at this point in time.
Absolutely, and it's really in keeping with our philosophy of recovery and principles of psychosocial rehabilitation, which are founded on dignity and respect and privacy. So patients have an ability to retreat to their private space, which is very important, that they have that opportunity to be able to wind down, relax, and self-calm in their own private space. The views are out to the courtyard, again bringing in natural light and building on evidence of what promotes healing and recovery.
Yeah, and so in each patient room there's a desk space, they have a wardrobe to keep their own belongings in, and they have the ability to lock the door into the room so that they don't have to be concerned about anybody else taking any of their stuff.
That's right, and they also have a private washroom and shower facilities within the bedroom, which is also unique, and again promoting dignity and privacy.
This is the dining room, and you know, as we all know, food is an important part of the day, and it gives an opportunity for the inpatient units to come down here. But the idea behind it is to really create that area of socialization, that the patients can come down here. There's a servery. So why don't we go in and have a look at it? So this is a great space, not only as a dining room, but also an area for socialization. So I anticipate you'll use it kind of for other things throughout the day.
I think many of the spaces on the inpatient units offer great flexibility in terms of their use. So for example, I could envision a card tournament going on in this dining room in the evening hours. So that's just one example.
One of the nice things about this space here is that it's got a great view into the courtyard. Each one of the inpatient units has a courtyard associated with it so that they're dedicated for the patient populations that are on a specific inpatient unit or floor. So it's a beautiful space out there, some shade structures, there's a fountain, some trees, and in one of the courtyards there's a basketball court.
We also have the significant inner courtyard on the main level, which we hope to have public, family, visitors, making good use of staff and patients.
Yeah, and for wintertime we have little greenhouses that look out onto those, so again it's trying to gain that access to the outdoor light. Each one of the inpatient units also has a little porch associated with it so that people, if they want to, right from the inpatient unit, can get out onto the little porch unit.
So we've been through our tour of the facility and walked through the patient's journey of recovery, basically through the house, the neighborhood, and the downtown. And I think the facility really embodies that journey of recovery and the healing process that patients will experience in this building. Thank you very much for joining us today on this tour of our new Southwest Centre for Forensic Mental Health Care.